Hey guys, it's Ashton. Today we are tackling what people don't tell you about top surgery. I did a video like this about taking T last year and a lot of people found it really insightful, so I thought I'd give it a whirl with top surgery now that I'm like a good year post-op and can kind of like talk about it. The main thing is that recovery is actually quite tough. I never had surgery before I had top surgery, so this was my first ever one. And I was kind of preparing myself for the worst, as in like not being able to move, literally like staying in bed for like weeks on end and like being bloody, and I was just mentally preparing myself for that and like all the pain. But it wasn't the fact that I was in pain. I had like minimal pain, like it was pretty much just discomfort. It was more the fact of the recovery to get him back to my normal routine life, I suppose, because I had 8 weeks off work. I was just finishing the summer holidays, so I wasn't in uni, so I kind of had all this time and I physically had nothing to do. I am the worst person for routine. I need routine in my life, otherwise I cannot function. I need to be busy. That's how I work best, is being busy. And when you're laid up for that amount of time, not being able to do your normal life, then, you know, it's hard. Emotionally, it's really hard. I found that the first like 4 days I had that post-op depression like straight away, and I really didn't anticipate to have it because I had waited so long for top surgery, and I was like, yes, this is day one of my life, I'm gonna start my life now. But it was the fact that I had to wait to start my life until I was like a-okay to do my life things. The main wave of depression hit me the day after I came home from hospital. So I stayed in for hospital for 2 nights, and then I came home and it was the morning, and I was sat downstairs and I was like, oh, I hate my life. Quite literally, like I was just so frustrated because I had drains, I couldn't drive for 2 weeks, I couldn't go out really, and I hate being stuck in. I need to be outside doing something anyway. Like I will literally go and walk to a supermarket. Like I just need to be out. So it was the fact that I was thinking so much ahead, like I'm gonna be like this for ages, I'm just gonna go mental. But you know, I learned that you literally have to take one day at a time. That's the way I got through my first like 10 days of post-op surgery, because once I had the drains out, then I was a lot more like able to move and like do more lifey things, I suppose. Wet wipes are your actual best friend. Honestly, I went through like 2 packs of wet wipes in a week. You can't shower, obviously, because you've just been cut open. Not a good start. So I couldn't shower until I was 2 weeks post-op. Yeah, 2 weeks post-op. So I tried sitting in a shallow bath and have a little wash, but no, I was too worried about getting everything wet, and I was just annoyed that I couldn't be right in the bath. I couldn't have a shower because, you know, that was just a recipe for disaster. So I just decided, you know what, I'm gonna stick with wet wipes and just keep myself clean in that way, which actually did work. And I always see people who are like, wear hats for like 2 weeks post-surgery. It's like, why are you not washing your hair? Just get it over the sink. Like, I wash my hair like every other day over the sink. It was like not hard. The day after I came home from hospital, I just washed my hair in the sink. It's not hard. And I had some dry shampoo in hospital. You know, get that head over the sink, boy. The thing that hit me straight away after I had surgery was, oh my god, I am so out of shape. I am so fat. Literally, my words exactly. That was the first time I've like been shirtless with like post-op binder on. Even been shirtless since I was like 11. And when you bind, you only look at the top half of your body. Like I would wear a tri-top binder, so I would always focus on this section of my upper body, and I would ignore the rest because I'm like, right, this needs to look flat. I don't care about the rest, you need to be flat. And I'd focused on that for so long that once that was not there anymore, I was like, shit, I'm fat. Literally. You're used to having like a binder on and you're not completely flat. You kind of even yourself out really, because you're not looking at your stomach. But then when you've got nothing, I was like, oh my god, I need to go on a diet. And that's what I did, and here I am now, 3 stone lighter, Thank you, surgery. Yeah, so just kind of prepare yourself that, you know, you're not gonna look chiseled. Unless you are chiseled, then congrats for being chiseled. I was really starting to notice like my curves more, and I don't know, everything I had been ignoring, I was noticing more now that my chest was like, yay, you are done, you look fabulous, but the rest of me, not so fabulous. Another thing that's hit me, and is still kind of hitting me, is that I'm not 100% flat. I thought surgery, bang, nothing, completely flat, but they can't do that because it looks unnatural. But they leave some breast tissue there, so you are flat, but you're not like 100% flat. And I'm still trying to kind of deal with that. The first couple of months it was fine because I was like, oh, I'm so flat. But now, because of exercising and stuff, like I built chest muscle, and it really, I don't know, it really fries me a bit because I want to be really flat, but I know it's not chest, it's like muscle. Like if you look at this, I'm actually like really flat, but I still get a bit like dysphoric that I'm like, oh my god, am I flat? But I know I'm flat. Dysphoria, my friends, dysphoria. Another thing that hit me that touches on to depression is what now, what next? Because I'd waited for top surgery for so long that I hadn't planned any of the rest of my life. And after I had surgery, I was just thinking, oh no, what do I look forward to now? And I kind of had to take one day at a time and be like, you know what, it's life. Like those little things you plan, like when you go out for food with your friends, when you go into a concert, it's these little things. These little things is what makes you carry on now, not just this major surgery. Because I knew that wherever it happened in my life, I always had top surgery to look forward to. That was always so far in the future. But now I've had it, it's like, so you've got to fill that void, I suppose. Incisions. Incisions are completely down to your body and down to your surgeon. I asked mine for more straight, but because I lost a lot of weight, they ended up getting a bit more curved, but they are happy days for me. I'm satisfied, like, they're quite, you know, as I would want them. But don't expect your incisions to be perfect, because mine have opened up a bit and I've had some eczema problems, and you've just got to kind of like deal with that as you go. And if you need to go to the doctors, go to the doctors, because within my first couple of weeks I had my side open up and I didn't go to the doctors, and I should have, and I think I probably had an infection, but it went away. But it did leave my scar a bit more thicker, so I wish I, in hindsight, had gone to my GP. But with my eczema I did, and my nurse, she gave me some eczema cream, but it was that confidence of being able to like lift up my top and be like, look, sort me out. Stemming on to incisions, I was told to use micropore tape for 8 weeks. Micropore tape is like the papery tape, the general hospital tape, and my surgeon told me to use that to stop my incisions from stretching. And I'd heard so many people stop using this tape after like a few weeks, and I thought, right, no, I'm going for the 8 weeks straight. You know, the more I use this tape, the less my incisions will stretch, and it had the complete opposite effect. They stretched my scars more because of ripping them off and on, because of the aggravation. And I also wish that when I did take them off, when I had to wear them, when my incision was still quite fresh, that I took the tape off in the shower. I would just take them off dry. I didn't realise you should have took them off in the shower. Obviously it moistens it, makes it easier. So yeah, that's kind of like what you need to do with the tape. So kind of listen to your own body on now and not what you think you should be doing. But I think the most important thing on this video is people don't tell you how much top surgery is actually going to change your life. I feel like in a way I'm such like a different person to how I was just before I had surgery. Like, I have a lot more things to look forward to now, and I suppose that's come with the confidence of having top surgery. People don't tell you how good it is to wake up and not put a binder on, to get out the shower and not like scramble to put a binder on because it's so hard with that moisture, when you could just whip your top off, go swimming. You could just buy whatever the hell of a t-shirt you want to wear, white, buy them all. I bought so many white t-shirts, nobody prepared me for that. But yeah, I hope this video was somewhat insightful. I'll leave a link to my what people didn't tell me about tea video here somewhere. If you are having your top surgery soon, enjoy this journey of the lead up to top surgery. I know you just want it done straight away, but enjoy the whole this is my last few weeks of binding and all of this stuff, and looking forward to what happens after surgery. Take one day of recovery at a time, because that is the best way to get through it, and make sure you have loads of box sets to binge. I watched Waterloo Road, all 10 series in my recovery. If you have any other things to say about what people don't tell you about top surgery, please leave them in the comments below and get some chats going. I'm sure a lot of people will appreciate that. And thanks again for watching, guys, and I will see you next time. Peace.